Hello, I am Dr. Sarunpong, a cardiologist at ViMUT Hospital. The heart is an incredibly vital organ as its primary function is to pump blood to all parts of the body. Generally, with conditions like skin or eye diseases, the symptoms are quite obvious. However, heart disease can often be a hidden danger. Unless there are severe abnormalities, few people truly recognise the significance of the condition. Heart disease can affect people of any gender or age, depending on their specific type of condition. For instance, elderly patients might face issues like myocardial ischemia or heart failure. Meanwhile, middle-aged individuals or athletes might experience an abnormally thickened heart muscle or arrhythmias. Younger patients may even have congenital heart defects. So, in summary, patients of all ages and genders can develop heart disease, though the types and forms will vary. There are several common misconceptions about heart disease. For example, many believe that being physically fit means they are immune to it. This is incorrect. Some conditions aren't solely linked to physical fitness, such as a patient's genetic makeup. Similarly, issues like an irregular heart rhythm aren't necessarily related to physical strength either. Take, for instance, elderly patients who have never had heart issues but have been diagnosed with other conditions like diabetes, high blood pressure, or high cholesterol. If these aren't managed consistently, they can become risk factors leading to ischemic heart disease or heart failure later on. Yet many people fail to see the connection between these conditions. Consequently, they might ignore them or skip treatment. This is a major reason why patients can develop heart failure later in life if these underlying issues are left untreated. Regarding controllable risk factors, we must look at harmful behaviours that contribute to heart disease. For example, heavy smoking or the use of certain substances. Secondly, consuming large amounts of alcohol over a long period can increase the risk of cardiomyopathy or heart failure. Additionally, chronic conditions like diabetes, hypertension, and high cholesterol are all significant risk factors for vascular heart disease, coronary artery narrowing, or even a heart attack. Most heart diseases can be cured or managed, though it depends on the specific type. This includes genetic conditions, congenital defects, or issues like heart failure and both acute and chronic ischemia. Nowadays, technology plays a vital role. With high-quality medications and medical advancements, we can now alleviate or treat heart disease much more effectively. At ViMUT Hospital's Cardiology and Vascular Department, we're equipped with state-of-the-art technology and staffed by experienced physicians. We provide comprehensive care from diagnosis to treatment for all heart conditions, including cardiomyopathy, coronary artery disease, and arrhythmias. We're here to serve you. For those without symptoms, I recommend annual heart screenings. These include ECGs and chest X-rays to detect abnormalities, as well as blood tests to identify risk factors. If you already have a heart condition or known risks, don't worry, you can trust our medical team. We're here to advise you on managing chronic conditions, lifestyle adjustments, and reducing your overall risk. By addressing these factors, we can help you gain much better control over your heart health. Your health concerns are my concerns. If you're facing any issues, I'm more than happy to provide full support and guidance. My goal is for us to work together so you can overcome these heart conditions and move forward in good health. Which is scarier, coronary heart disease or a heart that's lacking love? Coronary heart disease is more serious. A lack of love won't kill you, but heart disease certainly can. How do we tell the difference between heart palpitations from seeing someone you like and those from heart disease? Go on, doctor, tell us. Heart disease palpitations have no obvious trigger, but palpitations from meeting the one have a very clear cause, you. Doctor, you can treat heart disease, but can you heal a broken heart? I'm stumped. When it comes to heart disease, I can certainly treat that and provide the care you need. But for a heart that's lacking love, you might need to see a fortune teller. Who should look after your heart? ViMUT Hospital or your partner? For heart disease, come to ViMUT. For a lack of love, go to your partner.